CQC has a really important job. Our job is to ensure that people who use health and social care services have access to care which is safe, compassionate and high quality. This is the first year we've produced a state of care report based on applying our new inspection methodology. CQC is in a unique position. We're the only organisation that looks at all hospitals, all general practice and all care homes. No organisation in England knows more about the state of quality and safety in health and care services than CQC. This is challenging times in health and social care. People are having to maintain levels of quality and safety in the services that they provide within quite tight financial constraints. It's a challenging job. And what we're flagging in the report is that there's huge variation between those organisations that are managing to provide safe, high quality services within the money that they've got available, and those organisations who quite frankly are not able to provide that level of quality within the money that they've got available.
This year's report's important because it's the first year where we've had ratings across all of our sectors. We provide ratings of services to see whether they are outstanding, good, requires improvement or inadequate. By looking at good and outstanding services, we've started to see some key themes emerging. Services that are performing well do tend to have strong leadership.
In hospitals, we think that good, strong leadership is the key to delivering good quality services for patients. We've seen examples of really good and outstanding leadership, but equally we've seen examples of poor leadership, which are of concern. Where we've seen strong leadership, we've seen that there is a real focus on staff engagement so that they focus on the priorities of not just of the organisation but of the care needs of patients as well.
Speaking as someone who's used mental health services and who now assists the CQC on inspections as an expert by experience, I found that service user involvement is key in identifying themes that service users want and would like to kind of engage with.
They have open and transparent cultures, particularly around safety, so that they look at things, are very open about things when things go wrong and actually take action to rectify mistakes.
So safety is a key area that we look at in all inspections of general practice. It's really important that general practice has effective systems, effective processes, and that they are importantly turning those systems, those policies and procedures into practice. So what we're expecting to see and what we would look at are the areas around medicines management. We'd look at the premises, how clean it is, how tidy it is, are there effective audits. We'd look at the complaints procedure. We'd look at the employment checks for members of staff. Are the checks undertaken to ensure that patients are protected in the right way, with the right staff being employed.
Staff in adult social care services are really important for the quality of services that are delivered, and in particular the safety of those services, but also the full range of quality. And the reason staffing is really important is not just the number of staff, but also the skills and confidence of those staff. Are they able to properly support people's needs, to keep them safe, to respond to their needs and to deliver effective care?
I've found that staffing on the ward can be very important, as when the ward is sometimes a little bit understaffed, it can kind of affect on the one-to-one time that you have with your named nurse or members of the team, which could actually have an impact on your recovery and rehabilitation.
It's a very challenging time for the health and care system. We've had a period of austerity since 2008 which is unprecedented, and what we've seen over the years is a pendulum that has swung between organisations that need to be in financial balance to the pendulum swinging to organisations need to deliver quality. And I think what we're saying in this report is that moving forward, organisations need to deliver high quality, safe care within the financial envelope that they've been provided. We know by looking at the very good services in this country that it's possible to do that, and those services which are less good, if they look to those good services and saw what they were doing about the quality of leadership, the way they engage their staff, then I think there's some optimism for the future about how all services can rise to the level of the very good during what is going to be a very challenging period.